Hello and a very good day to you. We are fourth-year veterinary students from FEB UMK and would like to talk about a very interesting topic, which is Highly Pathogenic Avian Influenza, or HPAI for short. Now, what is so intriguing about HPAI? Let's have a look, shall we? HPAI is caused by avian influenza A virus from the family Orthomyxoviridae and genus Alpha influenza virus. It is further classified into subtypes based on two surface proteins, hemagglutinin and neuraminidase. They are also classified as either low pathogenic avian influenza viruses or highly pathogenic avian influenza viruses. Today, naturally occurring high pathogenicity influenza A viruses that produce acute clinical disease in chickens, turkeys, and other birds of economic importance have been associated with the H5 and H7 subtypes. Low pathogenic H5 and H7AI viruses can mutate into the highly pathogenic form of the virus. Subtype H5N1 is a subtype of the influenza A virus which can cause illness mainly in birds as well as humans and other animal species.
Avian influenza viruses are shared in the feces and respiratory secretions of birds. Once an avian influenza virus has entered a poultry flock, it can spread on the farm by both the fecal-oral route and aerosols, due to the close proximity of the birds. Fomites can also be important in transmission, and flies may act as mechanical vectors. Avian influenza viruses have also been found in the yolk and albumin of eggs from birds infected with the virus. Although HPAI virus-infected eggs are unlikely to hatch, broken eggs could transmit the virus to other chicks in the incubator. In the majority of cases, people got HPAI Asian H5N1 virus infections after direct or close contact with sick or dead poultry that were infected with the virus. Other risk factors include visiting a live poultry market and have prolonged, unprotected close contact with patients infected with HPAI Asian H5N1.
For HPAI virus infection, birds who are infected tend to show signs of marked depression, decreased feed and water intake, and other systemic respiratory and/or neurological signs. However, no signs are pathognomonic and sudden death can also occur. Some of the common signs include coughing, sneezing, sinusitis, blood-tinged oral and nasal discharges, ecchymosis on the shanks and feet, edema and cyanosis of the unfeathered skin on the head, comb and wattle, and diarrhea. Egg production may decrease or stop completely.
In humans, most infection with Asian lineage H5N1 HPAI viruses have been severe. Once infected, initial signs are often high fever and upper respiratory signs resembling human seasonal influenza. Some cases may have mucosal bleeding or gastrointestinal signs such as diarrhea, vomiting, and abdominal pain. Later, lower respiratory signs develop soon after the onset of the illness. Respiratory secretions and sputum are sometimes seen to be blood-tinged. Most patients deteriorate rapidly, and serious complications including heart failure, kidney disease, encephalitis, and multi-organ dysfunction are common in the later stages. In reality, avian influenza viruses can rarely cause disease in humans. However, general precautions are still recommended.
Lastly, for public health advice, please avoid contact with birds such as poultry and wild ones, and report sick or dead birds to the responsible authorities. Next, do not touch bird or carcasses with bare hand while handling. Instead, please wear gloves or use an inverted plastic bag to collect the bird. Make sure to wash hands properly with soap and water or use a suitable disinfectant after handling. Follow good food safety and food hygiene practice in line with WHO's 5 Keys to Safer Food program.
The core messages of the 5 keys to safer food are: Number 1, to keep clean. Number 2, separate raw and cook. Number 3, cook thoroughly. Number 4, keep food at safe temperatures. And lastly, for number 5, use safe water and raw materials. And this concludes our topic on HPAI. That is all from Group 2, and we want you to stay curious.